Good afternoon and welcome to Downing Street for today's coronavirus briefing. And I'm joined by Deputy Chief Medical Officer Jenny Harries and Dr. Susan Hopkins, the Chief Medical Advisor to Public Health England and NHS Test and Trace. We all know that 2020 has been a hard year and it's ending in this festive period, which is going to be very different. After all the efforts that we've gone through to control this virus, and in many parts of the country, this virus is under control. Just as we've got a tiered system in place that was able to control this virus, we've discovered a new, more contagious virus, a variant that is spreading at a dangerous rate. And I know that the vast majority of people watching today and across the country understand what we need to do together to get through this. And so today we're announcing further action within the tiering system and also some further progress on vaccines and on testing. And I just wanted to say this before I set out the details of what we're going to have to put in place. I know that these actions have consequences. I know how difficult it is. But I also know that it is right to take the action that's necessary to control this virus. Across the country, cases have risen 57% in the last week. The average COVID hospital admissions are 1,909 a day. That's the highest figure since mid-April. There are 18,943 people in hospital with coronavirus right now. That's almost as many as there were at the peak. And yesterday, there were 691 deaths reported. That's 691 people who have died just before Christmas. And our hearts go out to their families, their loved ones, as with all who've died from this horrible disease. I know the pain that this causes. So against this backdrop of rising infections, rising hospitalizations, and rising numbers of people dying from coronavirus, it is absolutely vital that we act. We simply cannot have the kind of Christmas that we all yearn for. Of course, it's the social contact that makes Christmas so special, but it's that social contact that the virus thrives on, and that's how the virus is spread from one person to another. So it's important that we all minimize our social contact as much as is possible this Christmas, and that will help protect ourselves, our loved ones, and the whole country. We've got to keep our resolve. We've got to keep going through this. And there's 4 areas that I want to update you on today very specifically. The first are those tiering decisions that I just mentioned. We know that the 3-tiered system worked to control the old variant and is working now in large parts of the country, especially in Northern England. But we also know that Tier 3 is not enough to control the new variant. This is not a hypothesis, it is a fact, and we've seen it on the ground. We've seen case rates rise in some of the places close to where the current Tier 4 restrictions are, in places like East Anglia, where we've seen a significant number of the new variant, and we've seen case rates rise sharply. It is therefore necessary to put more of the east and southeast of England into Tier 4. We're also taking action in parts of the southwest, where there are some early signs of the new variant and where cases are rising. Even though case rates in some of these areas are not as high as they are in the areas badly affected, in London, for instance, and in Kent, the direction is clear and in many cases quite stark. The doubling times are short. And we have learned that when it comes to being a matter of when, not if we take action, it is better to act sooner. So from 1 minute past midnight on Boxing Day Sussex, Oxfordshire, Suffolk, Norfolk, and Cambridgeshire, those parts of Essex not yet in Tier 4, Waverley in Surrey, and Hampshire, including Portsmouth and Southampton, but with the exception of the New Forest, will all be escalated to Tier 4. Bristol, Gloucestershire, Somerset, including the North Somerset Council area, Swindon, the Isle of Wight, the New Forest, and Northamptonshire, as well as Cheshire and Warrington, will all be escalated to Tier 3. And I'm afraid that Cornwall and Herefordshire have seen sharply rising rates and need to be escalated to Tier 2. This is not news that anybody wants to deliver, and I am truly sorry for the disruption that it causes. But I think people know how important it is that we take decisions like this to keep people safe and to protect the NHS. The second piece of news I want to tell you about is some developments about another new strain of this virus. Of course, the fight against the virus is a global effort, and we're constantly vigilant and looking around the world. And as part of our surveillance, and thanks to the impressive genomic capability of the South Africans, we've detected 2 cases of another new variant of coronavirus here in the UK. Both are contacts of cases who have travelled from South Africa over the past few weeks. The chief scientific advisor and the chief medical officer and others met their South African counterparts over the last day, and we are incredibly grateful to the South African government for the rigour of their science and the openness and the transparency with which they have rightly acted, as we did when we discovered a new variant here. This new variant is highly concerning because it is yet more transmissible, and it appears to have mutated further than the new variant that's been discovered in the UK. We've taken the following action. First, we are quarantining cases and close contacts of cases found here in the UK. Second, we're placing immediate restrictions on travel from South Africa. And finally, and most importantly, anyone in the UK who has been in South Africa in the past fortnight, and anyone who is a close contact of someone who's been in South Africa in the last fortnight must quarantine immediately. By quarantine, I mean they must restrict all contact with any other person whatsoever. We'll be changing the law to give this legal effect imminently. Now, these measures are temporary while we investigate further this new strain, which is shortly to be analysed at Porton Down. And I want to thank everyone involved for the seriousness with which I know that they will take these new instructions. I'd like now to move on to some more positive developments. The third thing I wanted to talk about is an update on testing. As you know, we continue rapidly to expand the testing capability here in the UK. We're expanding community testing yet further in areas where the rate of infection is highest. So we can identify people, and especially identify the around 1 in 3 people who carry the virus without displaying any symptoms at all. 116 local areas have now signed up for this community testing, and we're in discussion with more. And these rapid turnaround tests are proving to be extremely effective at finding cases where we otherwise wouldn't. And I'm today publishing an assessment of the Liverpool community testing project, which shows how effective this can be. I'd urge anyone who has the opportunity to take part to protect their local area. And at the same time, we're boosting rapid testing in care homes with a further £149 million to support that effort. So all those who work in care homes in England will receive 2 rapid tests a week, in addition to their weekly PCR tests. Finally, amid all of this difficulty, the great hope for 2021 is, of course, the vaccine. The vaccine is our route out of all this. And however tough this Christmas and this winter is going to be, we know that the transforming force of science is helping to find a way through. I'm delighted to be able to tell you that the Oxford AstraZeneca vaccine, developed here in the UK, has submitted its full data package to the MHRA for approval. This is the next step towards a decision on the deployment of the vaccine, which is already being manufactured, including here in the UK. We are, of course, continuing to deploy the Pfizer-BioNTech vaccine, which is being delivered now from over 500 sites all across the UK, and we're adding more all of the time and accelerating the rollout. I'm also delighted to be able to announce that we have begun vaccination in care homes. We know that people who live in care homes are amongst the most vulnerable to this disease, and I'm delighted that we're able to do this. Again, it's another enormous logistical challenge, and I'm very, very grateful to colleagues in the NHS and in the social care sector who've worked together so hard to make this happen. This afternoon, it gives me great joy to tell you that the Chelsea pensioners will be vaccinated, along with care home residents right across the country. I think we all need a bit of good news. And the reality is this vaccine program is the way we're going to get through this, because every time somebody's vaccinated, our country becomes a little bit safer, they become a little bit safer, and we get a little bit closer to the life that we all want to get back to. I sincerely hope that this is my last press conference before Christmas. And I want to just take a moment, firstly, to thank you and everybody watching for all that you have done and the sacrifices that you've made. And I also want to thank my whole team who've done so much, including those here, Susan and Jenny, but including the huge team in the NHS, in the department, and right across the board. As a country, we've been faced with these enormous challenges, and it's been very tough. But I especially want to thank those who helped this country to become the first in the world to roll out a clinically approved vaccine. I want to thank all those who've helped us build a bigger capacity in genomic testing than anywhere else in the world, and of course, the biggest overall testing capacity in Europe. I want to thank our scientists who've discovered the first proven treatment for coronavirus. And I want to thank everybody working in the NHS and in social care for the work that they've done this year, and also for the work that's going to carry on this winter. And especially to colleagues who are working over Christmas, which of course is so important in the NHS and in social care. Look, I know how hard 2020 has been for everybody. And after delivering some really difficult news, if I may, I want to end on a reflection of where we are as a country. This Christmas and the start of 2021 is going to be tough. The new variant makes everything much harder because it spreads so much faster. But we mustn't give up now. We know that we can control this virus. We know we can get through this together. We're going to get through it by suppressing the virus until a vaccine can make us safe. That's been our strategy, and that's what we must do. We're not going to give up now, especially after so much sacrifice. And I know that some of these decisions are tough, but I believe in that everybody making the right decisions, and I believe that everybody will do what is needed to keep themselves and others safe, especially this Christmas. And I know from the bottom of my heart that there are brighter skies ahead. And I'm now going to hand over to Jenny to give us an update on the data, especially on the impact of this new variant. Jenny.
Thank you, Secretary of State. First slide, please. So I'm just going to talk through about half a dozen slides which highlight in graphical array the comments which Secretary of State has just outlined. And as usual, the darker colours on the maps indicate higher rates or higher rates of change. On this slide, we can see on the left-hand side that in the last 7 days, this is the last full week, case rates up to the 17th of December, they've continued to rise at a very rapid pace. This is particularly in London, the southeast, the east of England, and in Wales. And you can see that with the dark colours there, which equate to more than 400 cases per 100,000 resident population. One of the most important things, though, is not just how many cases there are, but the rate of change. And if we look to the right-hand side, you can see that the darker pink and the purple is where those changes are really starting to move more rapidly. So as expected, it perhaps doesn't show up quite as well on the slide here, but as expected, again, particularly in London, the southeast, east of England and Wales. But you can also see that the colour is starting to change through the bordering areas, particularly into Suffolk, Cambridgeshire and Norfolk, and then treading down to the southwest. Next slide, please. What we can see here is 3 lines which are representing those areas which are currently tier 4 areas, so places like London, and that's the dark black line. And you can see that since September, there has been a rise, and then in November when the restrictions came in and we had, if you like, the original COVID, you can see that starts to decline, but then fairly soon afterwards, and particularly at the start of this month, you can see an extraordinarily rapid rise in cases moving upwards. The dotted line, the purple dotted line, are those areas which are now moving into tier 4. And you can see the same shape of curve here. What we're trying to do is identify where that rapid increase is coming, which is most likely due to the new variant. And you can see that it's a parallel line to the areas where we currently know have very high proportions of new variant in the cases detected. What's equally important, I think, is to look at the green dotted line, and these are areas in the rest of England. Obviously, a month previously, we've tended to see very dark colours at the north, northwest, northeast, and what you can see there is the rise during September, October, the November restrictions coming in, and quite a significant drop in that dotted green line. So against our old version of COVID, if you like, the restrictions had effect, and what we're dealing with now is almost two different patterns, one for the new variant and one for the old. Next slide, please. And here, this is clearer, I think, in this one. So these are cases identified, the proportion of cases which are positive for COVID-19 from November and then running in through to the middle of December. The dark purple line is cases which are new variant compatible, and the green line are the cases. So in some ways, this is reflecting the green and purple lines on the original map. And what you can see again is that the original version of COVID is been brought down from November. You can see quite a sharp decline in cases and a levelling off, but a very rapid rise in the new variant cases, which are moving forward at pace. Next slide, please. And again, if we just look at the 3 most affected areas, you can see this very starkly. The green line again is other cases. You can see that they've dipped from November. The national restrictions at that time brought them down. There is some rise now, but the real sharp increase, which is what we're dealing with, is the new variant compatible cases. And obviously these are the most affected areas. In other parts of England, we're starting now to see a mixed picture where the other cases, the original COVID cases, have come down, have flattened, but we're starting to see rises. And what we're looking out for is that very sharp incline in the rate of change. Next slide, please. And of course, unfortunately, this then translates through to occupied beds with patients who are COVID positive. And you can see here that the number of patients in hospital came right down over the summer period. It was rising steadily. The November restrictions have dropped that, but now it's starting to rise very sharply, almost certainly with predominantly new variant cases. And so we're now very close to the spring peak in terms of the numbers of patients in hospital. Next slide, please. And again, this is just looking in London and looking at COVID positive occupied beds, again, heading very much towards the spring peak. You can see the flattening off in the middle of November, but now steadily increasing upwards and causing a lot of pressure. Mostly, obviously, we're trying to treat COVID patients, but every time a bed is occupied by a COVID patient, of course, we need to think through of the impact in others seeking hospital treatment. Thank you.
Thank you very much. We now go to questions, firstly from the public and then from the media. The first question is a video Tim from Huddleston.
Good afternoon. I am one of the UK residents that finds themselves trapped abroad after being given little to no notice to return home. I now find myself stuck in Germany until next year. What is being done to help UK residents like myself? Thank you.
Thank you, Tim. Well, I can understand the frustration that you feel and others who are caught abroad by the measures that have been brought in to restrict travel from the UK. Now, obviously, we as the UK government want to see you able to come home, and we're having discussions with other governments right around the world to ensure that that travel can safely happen. So, for instance, you will have seen that there was an agreement reached with the French government, and also the European Union said that travel should continue, but they want it to continue, understandably, in a safe way. The problem with this new variant is that we are trying to restrict it from moving outside the areas where it is now at large, which, as you can see from the maps, is broadly the southeast and the east of England, including London. So the short answer is we're working with our international colleagues to try to get you home, Tim, you and others who are caught abroad by this. It's difficult, and we'll do everything we can to get you back. The next question is from Katrin from Southwest London, also by video.
Good afternoon and happy Christmas. Given the new variation of COVID-19, will you consider a move to online learning for schools for a longer period than the 5 days currently planned at the beginning of January term? Also, will you consider rolling out the vaccine for vulnerable teachers who are putting our lives on the line to keep schools open during the pandemic? Thank you.
Thank you, Katrin, and happy Christmas to you. As you know, we've put in place a new plan for the new year to ensure that there's testing in secondary schools to keep students safe, but also to keep teachers safe. When it comes to the vaccine, just before I hand over to Jenny Harries to comment, what I'd say is that we follow strict clinical advice in terms of the order in which people get vaccinated. So if people are clinically vulnerable, whether they're teachers or not, they will get early access to the vaccine. And I think following that clinical order of priority is very important, because that's the best way to protect life. It's also the best way for us all to get through to the other side of this, because once those who are clinically vulnerable are better protected, then it will get easier for all of us. Jenny.
Thank you, Secretary of State. I'm sensing from the question that, Katrin, you might be a teacher, so it's a good opportunity to say thank you to all the teachers who I know have been working really hard, because the public health implications of children being out of school are not just now, but they are for their lives. So it's a really important environment. In terms of clinical vulnerability, certainly the evidence that we have, and we're continuing to look at that, SAGE has been looking just in the last week or so at the data, doesn't suggest that teachers themselves are at any greater risk, but clearly teachers who are clinically vulnerable will be anxious. And as the Secretary of State has said, the different groups, the clinically extremely vulnerable, have been recognised and are already in the higher risk group, alongside those who are 70 and over, and those who are clinically vulnerable, i.e. have more general conditions, but nevertheless increasingly vulnerable in the face of a new virus, are included in group 6. So I hope that gives teachers assurance that those vulnerabilities have been considered, and obviously JCVI has looked at that independently, but we've been able to feed in much of the information and scientific evidence that we've had around different risk ratios.
Thanks very much. Thank you, Katrin. Next question is from Leila Natu at the BBC. Leila.
Thank you, Secretary of State. You've just said when it comes to coronavirus that it's better to act sooner, but the Prime Minister said on Saturday that the new strain was present across the country. Your Chief Scientific Advisor said on Monday that it wasn't possible to stop it from spreading beyond the southeast, and you're only announcing today the widening of Tier 4 within the southeast and east of England, and only from Boxing Day. Haven't you wasted valuable time in trying to get ahead of the new strain of the virus. And if I may, to Dr. Harries, you've talked about yet another more transmissible strain being identified from South Africa. How confident are you that the new 4-tier system is strong enough to tackle that?
Thanks very much. Well, as you know, when we got the information on Friday afternoon about the impact of the new variant on transmission, that it's that much more contagious, we acted incredibly fast to put the 4th tier in place. And then today we've broadened that. There are parts of the country where the case rates, thankfully, as you saw in the charts, have been coming down. And the whole basis of the tiered system is to take a proportionate approach to the areas where we need very firm action and other areas where we clearly need restrictions, but they don't have to be as drastic. Now, added to that, of course, is everybody's personal responsibility. And that is the critical thing this Christmas and through to the new year. It is really important that people make sure that they minimize the chances of them passing on the disease, because it's actually by all of our actions collectively that we get this under control. On the new variant and the South African variant, I'm going to pass to Susan Hopkins, if I may, who is the expert on the genomics, and then ask Jenny to comment on the epidemiology. Susan.
Great, thank you. So the new variant in the UK, which we've identified, is very different to the variant in South Africa. It's got different mutations. Both of them look like they're more transmissible. We have more evidence on the transmission for the UK variant because we've been studying that with great detail with academic partners. We're still learning about the South African variant, and you've heard already the measures that we're introducing to ensure that we quarantine people who are coming in from South Africa. And therefore, we are pretty confident, actually, that the system we have in place will help control the spread. Clearly, this needs to be continually monitored, and we have a genomic system in place to do that. And we are looking at to constantly enhance the detection of cases in travellers. I'll hand over to Jenny.
Thank you, Susan. So, yes, I think going back to the tier system, obviously, as you could see from the slides, against the old version of COVID, our original one we were dealing with, those tiering systems in tier 3 has been very successful. The problem now is that we have very high rising rates of the new variant in the UK. And I think just generally, we expect viruses to mutate. So I think this should not come as a surprise. What is obviously very clear is that the UK has a huge capacity to look at these different variants and advise at an early stage. So that's very positive. In terms of the tiering, effectively what it's doing, it's encouraging and tightening our own behaviours and helping us to keep those behaviours within the areas that we are living and working. And that actually is the most important thing. Although the virus in both these cases appears to be more transmissible, at the moment, on current evidence, the actual disease that one gets is no different. And so all of the basic measures which we are continually trying to do and which the tiers help us to do should actually prevent it. So normal things, wearing face coverings if we're with people, crowded places that we don't know, keeping our distance generally, keeping rooms ventilated, not going out when we don't need to, keeping all of our contacts down. So exactly the same interventions are the right ones, and they will work against all of the variants. What the tiers are doing are helping us with that behaviour and limiting us when perhaps we want to stray off course a little bit and we forget.
Thank you very much indeed. The next question is from Dan Hewitt at ITV. Dan.
Thank you, Secretary of State. Given the direction of travel here, isn't it now inevitable that the vast majority of the country, if not all of England, will end up in tier 4 at some point in the next few weeks? If so, why wait for that time? Why not do that more decisively now? On the new strain of the virus, I know it's early, but is there any evidence at this stage to suggest that it wouldn't work? So the new vaccine wouldn't work against this new strain? And a very quick fact question. Could we have the latest number, please, the number of people who've received their first dose of the Pfizer vaccination, please?
Thanks very much. So I'll answer the first and third and then pass over to Dr. Hopkins for the second question. The answer to the third is that we will be publishing tomorrow the full data on the vaccination programme so far, and we'll publish those as formal government statistics for the first time. And then we'll expand the statistics that are available around this program on a weekly basis as we're going to publish those data weekly from now on. On the first question, absolutely, we act fast, and you'll have seen from the action that we took and announced, the Prime Minister announced on Saturday, that we're prepared to act incredibly fast and take further action as we did this morning. We also want that action to be proportionate, and in the parts of the country where the number of the new variant is very low, of course we want to keep it that way, and the current tiers are working. What we've all got to do, as Dr. Harries has just set out, is we've all got to take responsibility for our own actions as well and reduce the amount that anybody might be spreading it, because of this critical fact. 1 in 3 people who have coronavirus don't know they have it, but can still spread it. And if we all act like we might have it, then that is the best way to reduce the transmission. Susan.
Thank you. So I would just reiterate that, treat everyone like they have it, and we'll start to get to a better place. From the point of view of the vaccine, so we have no evidence at the moment that the vaccine will not work. So actually what that means, in fact, is that there's strong evidence that it will work, because the vaccine produces a strong immune response, and it's broad, and it acts against lots of variation in the virus. What we are doing is laboratory studies with people who have had previous infection and who've had vaccine, to look and see in the laboratory how their blood kills the virus. Those take a number of weeks as we grow the virus and do those studies. As soon as they're available, we will, of course, release them. We will also be monitoring the people who've had the vaccine very carefully, as we would anyway in coming weeks, to determine whether they have a less risk of infection, both of clinical infection, but also of subclinical infection, particularly in healthcare workers who are getting regular screening. So we will have both laboratory data and then clinical data in weeks ahead that will help us. At the moment, though, we have all the faith in the vaccines that we have. They produce a broad response, and I would recommend that everyone who is offered one takes a vaccine.
Thanks very much, Dan. Next question is from Rob Powell at Sky.
Hello, Health Secretary. How confident are you that Tier 4 restrictions is enough to bear down on this new variant? And if it's not, what other levers have you got to pull to try and bear down on the new variant? And to Dr. Harries as well, you've outlined some pretty stark increases in infections in recent days and weeks. Do you expect those percentage increases in infections to be mirrored in hospitalizations and ultimately deaths as we go further down the line? And if you do, what impact will that have on the NHS?
Well, Rob, in answer to your first question, it took us some time to work out the 3-tiered system, which was calibrated to keep the old variant, the original variants, under control. And we got to a point that the tiered system, the 3-tiered system, was effective against the old variants. And in fact, there's an interesting study being published today in The Lancet that tests again the old variant against those 3 tiers. The critical question is Tier 4 working against the new variant, just as you asked in your question. We have made sure that the Tier 4 measures do as much as is reasonably possible, but it all depends on how people actually behave. This is a partnership. There's so much that we can do in terms of setting the rules and legislating from government with all of the consequences that those actions have. But there's something that every single person can and should do, especially with the vaccine. Actually, I was about to say on the horizon. It's not on the horizon. It's here. It's being injected into people's arms right now. And with just the time to get the vaccine rolled out left, we should all be extremely careful about the social interactions that we have, because it is, yes, about the rules that we set in government, but it's actually about how every single person acts. And the good thing is that throughout this crisis, the vast majority of people have acted in a really responsible way. They've done their bit. And of course, it's easy to see, pictures of people running for trains and what have you, but actually that has been a small minority. So let's all stick at it and not give in to temptation. And that way we'll be able to get through it and make sure that tier 4 is indeed effective against the new variant. There was a further question embedded.
There was, I think, about case rate rises and how that translates to the NHS. So obviously you can see from the slides that sharp rise in cases is going to need some stopping. And as Secretary of State has said, this is not something that can be orchestrated. It is something which we all have to do. And however sad a time of year it is for us to be reminded that we need to behave that way, it is a very stark reminder that we do all need to manage our own behaviours, keep our distances. I think, as I said earlier, there is no reason at the moment to suggest that the new variant will, if you like, turn into more severe disease or more deaths. But clearly, if we have more cases, then we will see rising numbers, and those numbers are rising quite quickly now. But it's not inevitable that they will. If we do all take those behaviours to keep our distance over Christmas, limit the number of people that we're with, those numbers are not inevitable rises. And one area where I think it's important to highlight, obviously, care homes and the elderly are areas where we have seen very significant rates, sadly, of deaths before and serious cases. There are significant measures in place now, and Secretary of State has obviously highlighted this afternoon that testing is going in urgently in response to these rising case rates. So I think with all the hard work which the care home staff have been putting in, and the residents themselves, of course, in quite difficult circumstances, there are opportunities for us to ensure that these cases do not just automatically translate through into hospital cases.
Thanks, Rob. It's on us all. Jane Merrick at the Eye. Hi, Jane.
Hi there. Thank you. To the Health Secretary, first of all, you said that tier 3 is not enough to contain the new variant and that it is spreading at a dangerous rate. And across the country, hospital patients is at the peak in spring. Nerve Tags said this morning that the new variant has seeded across the country. We're now hearing of a second new variant from South Africa. So why aren't we going into a full lockdown across the whole country? And if I could ask the medics, Neil Ferguson of Nerve Tag said this morning that there is a statistically significant, albeit small, evidence of an increased proportion of infections among the under 15s. Is there a case for mass testing in primaries and perhaps a staggered return for primaries as well as secondaries?
Thanks very much, Jane. So the answer to the first question is that the new variant is highly concentrated, and the stay-at-home rule in the east, the southeast, and London is aimed at keeping this new variant from spreading across the country. And that's why we've taken the approach that we have in terms of the tiering and expanding the number of areas that are in tier 4. On the education question, I'm going to ask Susan to answer on the virology, and then Jenny to answer on the question of the consequences, especially for schools.
So firstly, we have no evidence that this virus is more transmissible in children yet. But what we do know is that when this virus took off, the children were one of the few things that were happening at the end of the last national restrictions that was still happening and mixing. So it was more likely that the transmission could start in that place. And I think we have seen that especially younger age teenagers have seen a higher number of infections. There's much less infection in primary school children. And we've seen that throughout the pandemic to date. And we will constantly take decisions with the experts in education over what is best for the children, along with controlling the virus. And I'll hand over to Jenny to add some more.
Yeah, just to add to that, I think, as Susan has said, if we look at historically, if we're going back a few months now, what happened when we had very significant rates of the original variant COVID virus in the north, we did see rises in cases in children there, but they were very much lower than they were in the adult population. They did rise quite steeply in teenagers. And I think we do know that there is transmission, but as Susan has said, it is generally lower as you go down the age groups, and it is extremely difficult to untangle what the children are doing. So there is perhaps an assumption that if children are at home, they won't transmit disease, but we have to be really clear that that is the case. Schools are very controlled environments in many cases, and so we know what children are doing there, and it's very difficult to disentangle, for example, what a child is doing in school, what a child is doing at school gates or on the way to school or in their community. So I think education is really important for children, and we shouldn't jump to the conclusion that just because every child is in school, that is a significant place for transmission. And as Susan has said, there is a lot of work ongoing and continuous studies to try and understand this in a little bit more detail.
Thank you, Jane. Merry Christmas. Next question is from Sam Lister at The Express.
Thank you, Secretary of State. With the Oxford vaccine on the brink of being approved and 100 million doses on order, how soon do you think you'll be able to stand before us and say that the vast majority of the British public have been vaccinated and this virus is beaten? And how many people do you expect to be vaccinated before Easter?
Oh, Sam, you're so tempting. I really want to have a stab at the answer, but the truth is we just don't know. It depends on the speed of manufacture. I'm really thrilled that the full data has been passed to the regulator, and I have every confidence that the regulator will look at it with great capability. I want to put no pressure on them in terms of the decision or the timing of the decision. It is absolutely a matter for them. But then we've always said that the vast majority of the vaccinations will be in the new year. And I think that our vaccination program started before most people expected it to. We've made really good strides over the month of December so far, and we will go as fast as we possibly can. This will be a big task for the NHS. What I would say in terms of the number of people vaccinated is that I think we will get there by the spring, that people should therefore just hold on and really try to resist temptation to do things that they shouldn't and to see people that they don't need to. And I know that that is tough and it's going to be a tough winter, but the more people do that, the more quickly we're going to get through this together. I wish I could give you a more direct answer than that, but we just aren't there yet. The true answer will be as fast as we possibly can. The final question from Arj Singh at the HuffPost.
Hello. People are pinning their hopes on the vaccine allowing a return to normality in a few months. But Professor Stephen Evans of the London School of Hygiene and Tropical Medicine suggested this week that the UK wouldn't be able to get back to normal until half the population had been vaccinated. And there are some suggestions that might not happen until 2022, unless rates of the virus are very low. Given the emergence of a highly transmissible new variant, has the government overpromised yet again in suggesting that Easter could mark a return to normality?
No, I'm highly confident that we'll get things back to normal before 2022, based on the speed at which we can roll out the vaccine. Not least because it's really important that the speed of rollout of the vaccine is accelerating. All the time we're adding more places to where the vaccine is being deployed from. And so we're accelerating the pace of the rollout. If you take the current pace and take that as a given, then without an acceleration, you would get to the wrong calculation for the speed at which this vaccine is going to be rolled out. But each venue that we open for vaccinations has to be approved, has to be got right. It's very, very important because you've got to make sure that the vaccine gets into people's arms in a safe way so that we know that they're safe, but also that the vaccine works. That's why we're not putting projections on these figures, and precisely as you say, to make sure that we only commit to that which we know we can deliver. I don't know if anything to add, Susan?
No, I agree. The sooner we vaccinate people, the better, but it will take some time.
That's right. Thank you very much indeed. Thanks, everyone. That ends this coronavirus briefing. And the final thing to say is I wish you all a happy Christmas.